I want to teach you what I know and what I teach my patients, and really be strategic and very, very practical. Very, very simple. It's actually not rocket science. I want you to know that. But first, I'm going to ask a couple of questions to just make you aware of certain patterns so you can answer. And then at the end, I'll ask for questions that you may have. So won't be able to address your questions as we go, but at the end, you probably will see a lot of your questions answered anyway before we finish. So, so first question is, I have a list here. How many of you, you're right, thank you. How many of you actually have never been tested for EBV? Say me if you've never been tested. I don't see anyone saying me. Okay, everybody has been tested one way or the other. Next question. How many years did it take you of being miserable and ill to finally get somebody to test you for EBV? Give me a number in years or months. How long has it taken you when you got your first test? Post your answers. Denny's 10 what? 10 years? 1.5 years. 20. I assume 20 years? 10 years. 10 years, Denny's, yes. It is 40 years. It is awful. It is unnecessary. It is not right. 1 month. Okay, Barb, you were really lucky. 8-10 years, Jen. It is 20 years. Really, really, my mission is to make this EBV a household name for clinicians and to get it tested properly fast. 20 years, 10 years. Okay, you guys. Hi, Susan. 10 years for you. 20 years. Terrible, terrible. So let me tell you for future, if you ever, let's say, cannot work with your doctor anymore, cannot get to the labs, I have a website called EBV Help, like H-E-L-P, like helping, EBV Help, and we have a website page with labs and diagnosis. And if you go to that page for labs, you're going to see 2 buttons somewhere in the middle of the page, color-coded, really big buttons. These are just 2 labs. Example, there are more. 2 labs of direct-to-consumer labs. You can click on them. One is life extension, I remember. The other one I don't even remember. You don't have to wait 20 years for a doctor to agree to test your EBV. Okay, so if you have to retest it, life extension, I just checked yesterday, they had a price of $102, something like that. 5 years, 27 years. Yeah. Thank you for posting, ebvhelp.com. Yes, so you can always go there and you can get labs done locally in the States. It doesn't matter. These labs, you pay them a little, but you're independent and you can do your lab when you need it. So I do not want you, because sometimes I hear stories when people go from doctor to doctor just trying to ask somebody who would be willing, right? Okay. So now, next question. Thank you for answering. This is terrible, isn't it? 20, 30, 10 years. How many of you have been tested more than 3 times already for EBV? Thanks, Jen. Jen just posted the link to those. If you need to test anytime, you can just go even there. I am not financially implicated there at all. I just posted them because these are examples for you. 4 times. Run 4 times. How many times have you guys been tested? 5, 6 times. So you are experienced in it, okay? Once only, okay? $40,000 in tests before finally tested. Ay. 2 times, okay. Big difference, right? So think about this. If you look at research says if you have conditions that do not respond, 6 times, oh my gosh. Hi from Dallas. Hi Casey. You can suspect, and this is clinical research saying, if you have condition that you cannot diagnose, there's something going on, it's chronic conditions, you're not getting better, you don't respond to any therapy, a medical doctor should consider testing with chronic EBV. So these labs, you know, there's research for it, and I list this study in my book, and it's also on that EBV Help website. You can go to that website, and Jen will list it again later, and really pull that study and show it to the doctor. So you really have to talk to the doctor. If you work with somebody, it's like, look, test me because maybe I haven't been tested or I need to be retested. And also research says if there's idiopathic condition, meaning we don't know what it is, what's causing it, it's chronic, suspect chronic EBV. Pretty big, isn't it? Pretty big. Too many to count, Casey, yes. Okay, so I want you to be aware of one more question I have, and then I'm going to start explaining why I've been asking these questions. So, bear with me. How many of you, actually two questions, how many of you have the more than 600 level of one of your antibodies? And they're always more than 600. I bet some of you have seen those. Usually it's NA and VCA, IgG. I think there's a little delay here. So, yes, more than 600. Yes, okay. Yes, okay. So, this is the biggest issue people have, the biggest challenge and biggest heartache, which is completely unnecessary. So, and Robin and Dennis, I can see, and Barb. And Susan, yeah. So, here's something very, very important that I want to share. Is that, think about this. People don't realize that. The lab will not tell you the number if it's more than 600, right? Well, you don't think about it, but it may be 7,000, it may be 5,000, it may be 2,000, it may be 800, it may be 1,000, right? So let's think about that. You get better, you get on a good food protocol, you have some supplements, you feel better, right? Anybody has done that? And then you start feeling better. Your thyroid is better maybe, your fatigue shifts, your brain fog shifts. You're starting to feel better. You're starting to be hopeful. You're starting to believe that you can get better. And then, of course, you go back and test because we are all about testing. And then you test, and then you still have those markers more than 600. Anybody has done that? And you are completely deflated. It's like, okay, it doesn't work. I don't understand. I am scared. I am anxious now. I don't know. And you're starting to spin, you're starting to get depressed because, you know, what are you going to do with it? It's still the same. Anybody had that experience? Yes? I get a yes? Yep. Big issue. I want you to remember this. Yes, exactly. So a lot of you are saying yes. And I hear it all the time. I need you to understand that you are not your lab. You are a person. Remember, you may have had triple of 600, maybe 1800. Maybe you cut it in half, maybe it's 900 now, right? You cut it in half, you decrease 50%. How are you going to know? You won't, because it will still show as more than 600. Are you with me? Does it make sense, right? However, let's say you have Hashimoto's. And because you're testing EBV, maybe your doctor will test your Hashimoto's antibodies, your thyroid antibodies, TPO, thyroglobulin antibodies. So what happens if you do these labs, it's still more than 600, you are completely deflated, demoralized, you're tired, you just don't know what to do, but then your doctor shows you your TPO, it's like, oh my gosh, your TPO dropped by 50%. Your thyroid is getting better. Anybody knows where I'm going with this? You are getting better. You go by other conditions you have. Remember, EBV can mask all those chronic conditions. Maybe your joints are better. Maybe your thyroid is better. Your brain fog, whatever that was, your typical symptoms. If they're subsiding, they're getting better. If other markers are better. For example, you have Sjogren's and you haven't made saliva for 15 years and suddenly saliva is produced, you're getting better. That can be caused by EBV. And so I never want you to take a lab value over how you feel. Lupus, yes, of course. Okay, so that's a huge issue. Now, anybody is happy to hear that? Does it make sense to you? Is it going to help you move forward in future? Let me see if I can get some feedback. I really need you to know, I need to know that you get what I'm trying to explain. You cannot get desperate because that 600 is still there. It will continue dropping and eventually it will go under 600. Yes? Cool. Okay, perfect. All right. Okay, so let's talk about those antibodies. There's one thing that is more rare, but especially maybe in different countries. I want to ask you if anybody has experience with this. Perfect. Thank you for your feedback. I love it. Yes, so it will never define you. Go by, you know your body, you know what's improving. You go by that. And then eventually it will, you know, be $4.99, $4.50. It may never go to zero. It's okay. It's okay. I'm going to talk about that too. Let me get one marker out of the way because it's rare, but in some cases your doctor may recommend it, and then you will be confused. So something called PCR. I need to know how many of you have ever had your doctor do PCR testing. I'm going to explain that, and then I'm going to go for those 4 big ones, and I actually have a little picture here for you that I drew. PCR. Say me if you've had it tested. Probably not so much in the States. It's not very common that it's tested. Let me see. Anybody? It looks like it's no. Okay. Nope. Okay. All right. Okay. Never. All right. Just in case it happens ever and the doctor wants to do it, you may not want to bother with it because it is only. Let me see if I cannot hide the darn thing. PCR is the DNA of the virus. Okay, so imagine that you are reactivating, and right now your virus is spilling in your bloodstream. All right, so the virus, the DNA of the virus, there's going to be DNA in your bloodstream. So PCR picks up. You might have your hand over your mic. No, I don't think so. Can you hear me, you guys? Jen, can you hear me now? I'm going to continue talking, assuming that you guys can hear me. Okay, perfect. Thank you. Thank you, Denise. So, if a doctor tests it, if you look at studies, if you look at clinical application, and it's very consistent, PCR, yes. It's hitting my scarf. You guys are too funny. I hope you can see me and hear me. That's all I want to know. So PCR, the DNA of your virus, thank you. You can hear, good. Will show within just few first weeks, between 5 days and maybe 25 days. And it typically, like, it's 95% accurate if you have a very first infection in your life, okay? First one. That's what the research says. If you have chronic EBV and somebody wants to retest where you are and they're going to suggest PCR, it may be expensive. So it's not really worth it because when I looked at studies, only 3% of people with chronic EBV showed positive PCR when they were reactivating. So it's really not worth it, okay? That's why I wanted to get it as well. Hello, Baltimore. I wanted to get it out of the way because it may only be relevant if you are right now having a mono, okay? And you want to confirm it. Good? PCR. All right. Now we're going to go about 4 markers. So I actually had these written down, but I see that these are flipped. And I am not techie, so I don't know how to unflip it so you can read it. But I have the visuals, and you guys, everybody pretty much has had tests done. So you have seen those 4. And so, number 1 that I want to ask you, always request all 4. Do not let your doctor skip any one of them, because you need to see them together. You need to see the pattern. Good? So, I may actually show you. It's going to be a little harder because it's flipped, right? And let me see. So you're not going to maybe see. We're going to start from this side and go this way. So that's the trajectory. So I'm going to show you the colors. So let me see here. Let's look at the red color on the right. This is the beginning of your journey. So this is how I want to see it. Actually, the whole image here, this is brilliant. I really fell in love with this, and this explained a lot to me way, way, way back when I was starting to do research on it. And so I posted this in color from the study, from the original study on ebvhelp.com under labs and diagnosis, actually. So it's color coded too, so you can, and it's in the book. In the book it's black and white, unfortunately, but there it is color coded. So you can always go back to it and refresh your memory. So when you're working with a doctor and somebody's telling you you have it, you don't have it, you can cross-reference and you'll know exactly where you are. I'm very visual, so I know that it made a huge difference to me. So we're actually, timeline goes this way, so it's kind of counterintuitive, okay? So just bear with me. So the red one, as you can see, we're starting 1 month and 2 months, somewhere here. The red one is your VCA IgM. The VCA IgM spikes with the primary infection. This is when we were talking about PCR, showing briefly. So VCA IgM is typically first infection, okay? And the problem with first with the mono concept is people think that, all right, first infection is mono. It could be mono. It doesn't have to be mono. Because if you were a little kid and you had a little sniffle, you had a little flu, a little cold, you were very tiny, maybe an infant, it might have brushed against you, you might have had infection, but it might have been very mild. Especially we see in medical research about the Western countries and the developed countries, that's how it presents oftentimes. So that's why some people say, I don't remember having mono. Anybody doesn't remember having mono? Because in medical literature, they assume mono is the first infection. If you haven't had mono, you haven't had that first infection, right? Anybody doesn't remember having mono? Me, exactly. A lot of my patients don't remember. Although it could be just a mild flu or bad flu that you don't remember, but you could have had it as a little kid. Exactly. You remember, yeah. If you remember, you can't forget because that's bad. Yeah, you don't remember. Exactly, Ron. Okay, you see what I mean? You see? So you can't get stuck in this black and white concept of the virus, what it is not. It's a very gray area. Is that helpful? So this red one, VCA IgM, this is the initial one, okay? So how many of you guys have mono right now? Like first time ever you have mono and you are just tanking and you're barely here listening and you can't even comprehend half of what I'm saying because your brain is foggy. Anybody has mono right now? Not reactivation, just first time ever. Like first time when the truck ran you over, you've never experienced anything like it. Because if you are in those shoes, then you will have that red one, VCA IgM, VCA IgM, that would be elevated. And so, I see your comments, terrible stories. Some of you guys have gone through terrible stories. So I want you to focus now. So VCA IgM, in your case, when you have chronic condition, when your EBV maybe is not every day, but you have Hashimoto's, you have Sjogren's, you have lupus, you have all these, maybe multiple sclerosis, who knows, autoimmune conditions, or just chronic fatigue. Your VCA IgM will typically be normal. Anybody has normal VC-IgM every single time you test? It's always normal? I just want you to tell me if this is your story, because I see that most commonly. VCA-IgM being normal. And so your doctor will tell you VCA-IgM is now. You don't have it now. You don't have EBV. You had it because VCA-IgM is normal. Take a look at this. You see this little dip after years? This little red one? VCA-IgM can reactivate after years. See that? But it's like a little bubble. It's very low. So for most people, when they reactivate and reactivate and reactivate, it will not flag up. It's just going to remain normal. It's just not enough to flag up. So the concept of IgM being only the, it's only the first infection, and then if this is negative, it does not mean what is typically said. This has nothing to do with EBV. You had it in the past, it has nothing to do with EBV. Whatever your condition is, has nothing to do with it, right? It's not a correct statement from your doctor just because this was just initial infection. But the doctors don't appreciate that EBV has a chronic latent aspect. So most of its life, it is chronic and kind of latent, and then it comes back and come back. So as I said, remember, test it every time, but most of the time it's going to be negative, 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 negative. You still want to see it. I did see a couple of cases, but literally maybe 2 or 3, when people always have VCA-IgM that is elevated. And I don't quite know why. It may be that it's bad enough that this is big enough and it always flags, but it's unusual. Okay? All right, let's move to the big ones, the ones that are typically more than 600. These would be the 2 ones. Anybody wants to tell me which ones, class? You know it. 2 big antibodies are always high, like hundreds, triple digits, or more than 600s. Which are the 2? I'm going to test what you know. Anybody? What are the 2 antibodies that are typically always, they're always high, sometimes more than 600. These are the ones that frustrate you. So you have VCA-IgM, it's always negative. And then those 2, you see those 2, blue and green? You see how they rise after the first infection, and then they stay high over the years, and then there's the reactivation right there, and they kind of go a little higher again. EBNA, yes. EBNA is 1. And VCA-IgG, yes, VCA-IgG and EBNA, exactly. So VCA-IgM was the red one, remember? The one at the initial infection. But then at the same time, the green one, VCA-IgG, rises and then it stays high. And then when you reactivate, it may go a little higher. Okay? And you can see, and the third one is NA, nuclear antigen. So that's the blue one. As you can see, it's going to start raising into the second month of the first infection. The first infection is, and then it raises as well and stay elevated. These both stay elevated for your lifetime, pretty much. Okay, exactly. You have 128. You will have triple digits, and some people have more than 600. Remember that, more than 600 when they don't give you the number. So I already told you. I'll remind you. If these continue to be over 600, we don't know how bad they were and how they've been dropping closer to 600. So you don't want to stop living your life when you start to feel better, because you start believing in those labs that there's nothing changing. It is changing. They're probably dropping. And then if you wait long enough, they may drop below 600 and you will get a number. So you can track it. So now, So I mapped out the big picture here, and then we're going to go for the most important. Oh, by the way, do not expect these two to go to zero. You can be completely living your life, healed, you know, managing and doing great and having your saliva and you know, your thyroid may be perfect. And if you test those two, they can still be elevated. So I do not want you to stop living your life because of these, because they're not supposed to go to zero. You are tagged for life. And so, but they will be dropping. So maybe they will drop to 128 or 60, you know. It's just a direction. That's why I always want you to retest all 4 of them so you can see them together and see how do the numbers compare. Do I still have more than 600? Because one of those days it may go below. Woohoo! That would be amazing. All right. All right, so bear with me. I'm not done. There's one more antibody that is the most important of all these. All the story. If you don't remember anything from today, this one I need you to nail. So anybody knows which one I'm missing? Number 4. Which antibody it is? I need my glasses so I can see you here. There you go. Who can tell me what it is? I don't want to show you yet because first I want to see who knows. Of course you know it. We talked about VCAIGM, the initial one that never returns, and then VCAIGG, G, think about the gradual, G forever, and then NAIGG, forever. Carmen, yes. Steve, yes. You guys know. Early antigen, yes. You got it. Good job. So take a look at this graph. It's going to be black. So look at those 2 bubbles. When you have the first initial infection ever, possibly mono, right? You see the red one. That's the big one, VCAIGM, right? But like within the first month of the first infection, your early antigen is also going to increase. Okay, so you're going to have, those 2 will possibly be positive. And then it goes dormant, as you can see, nothing happens. There's nothing here between reactivation. VCAIGG, the green one is positive. EBNA is positive, but early antigen, nothing here. Negative, right? And then you reactivate and what happens? Early antigen comes back. Early antigen comes back. So who has done the testing within the last week? Anybody has done this test within the last week? And tell me if you actually had early antigen positive or negative. Because that will actually explain where you are today. Dennis, did you get your results yet? Last month. Okay, Denise, do you have the results? Who has results from the last day or 2 or 3 days? Something very recent. This is the one I want. February 14. Okay, Jennifer, February 14. So was your early antigen positive? Jennifer Burns. Waiting for Jennifer to tell me. I just wanted one. Okay. So let's do this. Let me ask you a couple of questions because I really want you to be independent. Tell me if you've never heard of early antigen. This is the most important one. If your doctors have not tested it, it's a critical error, really. And this is not my opinion. This is all research. I've done a lot of research on it. Okay, so LA and Dujinsky, yours is positive, and this is recent. So if yours is positive, you are reactivating right now. But what I want you to see is, you see that the reactivation doesn't have to last long. So you can get really confused or you can get really clear. And I'll give you an example, a perfect example, how I want you to understand where you are. One of my students texted me once and said, okay, I have a classic case. I know it's chronic EBV. Okay, classic presentations, common symptoms, and so on and so forth. And the person tested and early antigen was normal. Okay, so now what are you going to do? What are you going to tell your family? What are you going to tell your doctor? What is your doctor going to say if your early antigen was negative? Here's what I want you to do. If you really want to know, I talked to my student and said this. When did she test? January. Okay. When did she feel like a truck ran her over? When was this worst time when she feels like she's flat on her back, can't pick up, she was run by a truck, literally? And she told me it was Thanksgiving. But she tested in January. She tested in January. So let's say this is Thanksgiving and this is January. You see what I mean? By the time she tested in January, the curve for early antigen was going down. She was going more chronic again. Does it make sense? So if you want to really know, and it's a very important lesson actually, next time you feel like the truck run you over, like you really feel the worst, this is where you don't want to wait, because if you don't test within a week or so, you may miss it and you will not know if this was EBV related or not, right? Okay? So you feel terrible, but it would be a good time to go and test. Okay, so far so good, you guys? Class is still with me? I have to, I can't read without glasses, okay. Okay, some people like Elaine, you test December, you test March, very good, because then you can see the pattern. And you can maybe plot it like here, plot it on a timeline so you can see where the body's struggling, what the body's doing. Okay, awesome. So now, to complicate things, okay, is there anybody that has been testing EBV, you think you have it, everything fits, but your antibodies are negative, always, all of these, nothing comes back? Anybody has that? So I need you to tell you, if you have a situation when you suspect you have chronic EBV, everything fits like a glove, but your antibodies are negative, this is what you need to do. You need to talk to your doctor and ask your doctor to test total immunoglobulins, IgG and IgM. Because if you're compromised, if you're sick, if you have problems with the immune system, you may not be making those antibodies. You may not have enough of those globulins to make those antibodies, so they will be false negative. Okay? Also, is anybody there who always has negative EBNA? EBNA? Always negative? For some reason? 5 to 10% of population doesn't make EBNA. So it'll always be negative. Now, also, keep in mind, 90% of population will have positive VCA IgG and positive EBNA, and they're not sick. They just have it. Okay? So if this is the only thing you have and you feel perfect, you don't have to worry about EBV, but you still want to test all four. Okay? Keep a tab on it. Okay. So, what I would encourage you to do is, now after this talk, you can look at your labs again, look at the trajectory of your labs, go to ebvhelp.com, click on labs and diagnosis, click on this color table that I have in there. I also have a table with different scenarios. I have this positive, this negative, so you can kind of read it again, so it'll stick, because you know it's I kind of messed up with your head a little bit. I want you to practice and get it, internalize it, so no matter who you talk to, which doctor you talk to, you actually talk from the perspective of research and science, so you'll be updated on that, maybe even more than your doctor. It's very important that you know your stuff, and so you can have a discussion. And if you really want to dig deeper into some other complications and rare scenarios with these, I have more of these in the book, the EBV solution, and it is actually a whole chapter is on it. Okay, so now if you have questions related to the labs, I'll take a look. I don't know if I can, if I know the answer to all of them, but let me see. Yes, Carmen, exactly. I want you guys to be equipped before you go to the doctor. And that's that. And if the doctor has no idea how to hear that information, you need to hire a different doctor who is with you. If your IgM is positive, Ron, you keep reactivating. Most likely you keep reactivating. Sometimes VCA IgM can be false positive, sometimes false negative. That's another one. It's very rare. But if your VCA IgM is always positive when you test, and when you test, Ron, you always feel crappy, then it may be just that it's so bad that there's enough of it here to actually, the red one, to actually flag. Hopefully that makes sense. Yes, Robin, rewatch it again and again. I want you guys to, so nice to have you here, Robin. I want you to understand that. The early antigen in close to 100 is really high. So Jennifer, yes, you are reactivating. Let me see here. So Carmen, if you want to create user-friendly way to keep your numbers graphed, I would go to my website when I told you and even print that graph. It's really nice. It's much nicer than this, obviously. But you can do the same thing and just graph it like that for yourself using that. Let me see if there's any questions. Casey, thank you for the book. That's wonderful. Okay, I'm looking for your questions about labs that maybe I haven't addressed. Always positive, Laura. I see. So yes, Tammy Nicole, you need to start testing early antigen. And you guys remember, if you missed it, if you start feeling better, and then you go testing, the early antigen will not show again anymore. All right. So, let me see. Post questions now if you don't mind. So I see them coming and I can address them. I'm looking. You have high EBNA, high VCA-IgG. Should we be concerned that we may have high contagious? Oh yes, contagiousness. Okay. Excellent question. Are you contagious? Are you contagious? Okay. Love this question. 90-95% of global population has EBV, okay? We can't live in a bubble. If you're a mom, your child could have gotten it through umbilical cord, through saliva, kissing, you know, spouses have it, share it. It's not something that you should really feel guilty about. This is why the scientific community is trying to come up with a global vaccination because we all have it. But you could have two spouses and one has EBV and the other has EBV and one clears it and moves along and the other goes chronic. That's the difference. So the difference is in how well equipped your immune system is, how much stress you have, how poorly, you know, how poor your nutrition status is. All these factors, stress, lack of sleep, overworking and all that. And, you know, more women get it, more women get autoimmune disorders. Is it because more women are susceptible to stress? We take on too much and we internalize. Stress is huge. So I would say concern with being contagious. Contagiousness is on and off even months after you have reinfection. So it really almost is irrelevant. But if you feel more comfortable, obviously you don't want to kiss and share saliva with somebody if you really have mono symptoms, very acute, because you will not feel good about that, obviously. But even if you look at studies, you could have roommates, and one of the roommates has mono, the other one may not develop mono unless they kiss, unless they share saliva. So it's I wouldn't be that concerned. I understand there's just no escape, but not everybody gets sick. So if your early antigen is dropping but all numbers are staying, then you basically stay in chronic. Yes, you stay in chronic. So distinction, remember, don't look at the lab, look at the person. So if your VCA, IgG, and EBNA are elevated, but you have perfectly healthy life, you don't have symptoms, you don't have antibodies to autoimmune conditions, you don't have chronic fatigue, your brain is not on fire, you perform your job, you take care of the kids, you run, you exercise, and you don't fall apart after exercise. You see what I mean? You don't wake up at 3 a.m., you're not on fire. If you're doing great, you are one of those 90% of people that are perfectly fine and have antibodies, because they are in most people, those two. Or you may be chronic if you have conditions. So that's the distinction. You know, I assess where the person is by looking at their timeline. Like, what is your life story? Rheumatoid arthritis, depression on and off, weight gain and depression with stress. Like, there's certain hallmarks, like, oh yes, that's probably EBV. Let me see here. Let me go down here. Let me see here. I'm never doing great, just had to have emergency surgery. Yes, so you have a chronic condition, Carrie. And Jennifer is giving me a lab. Yeah, so Jennifer Burns, you have reactivated, chronic reactivated EBV right now. Your early antigen is very high. It's 99, 90. It's almost 100. That's a high number for early antigen. So you are, you may want to read my book. We made a rule in our house, no sharing foods, drinks, just in case we have 3 kids. Your 3 kids, Holly, have been with you for a long time. They are fine. There's nothing that they haven't been exposed to. That's very sweet, but you don't have to really worry that much. Let me see here. Grandbaby is fine, Casey. We're all, it's like breathing air. It's just part of our makeup. This virus has been here for 1 million years, much longer than us. Why CDC doesn't consider it epidemic? Depends. Infants often are not hit very hard. Kids may be hit hard with the liver or with the spleen, but it's not a high percentage. It's later in life when it goes really into autoimmune disorders. It takes time, and also, it takes decades of something to turn into a cancer, right? It's oncogenic. It can turn into develop into cancer. Autoimmune conditions don't develop overnight. So when we become adults, then it becomes epidemic. With the kids, they would know that there's epidemic, because I don't think there is. Denise, anytime you are on immunosuppressant medications, you are actually preventing your immune system from doing its job. So in some cases, and if you look at research, it's contraindicated when you do have chronic EBV. But let me see if there's any questions on the yeah, so Hashimoto is your presentation, so you keep okay, you keep getting that. Yes, you don't donate blood in fear of being reactivated. Well, if you donate the blood, then other people may may become infected. Yes, and unfortunately, blood transfusion is not tested for EBV. I totally understand that. Okay. So, last thing I want to say, I want to thank you so much for attending here. I want to share something very, very exciting. We've been working on it for, well, I've been working on it for a few years. We have, I want to spread the word really for more people. We have a wonderful webinar we're going to start with. It's going to be on Monday. And just like Jen says, we're going to help you navigate the confusion. There's going to be more about what I do and how, what kind of concepts and myths we have to clarify, where people get confused and really derailed. It's very unfortunate. So it's going to be a message of hope. It's going to be a little bit of education again. And it's going to be inspiring and give you a lot of ammunition to move forward. So let me know if you can see the link that Jen posted. Can everybody see that link? We have, the title is the 3 myths to, what was it, Jen? I don't even remember. We have a wonderful title. The 3 secrets to moving from feeling beyond broken to thriving again. I don't want anybody to feel broken because of this virus. So hopefully you will join us. There is a link. Let me see. Laura, I have a little virus in my ear. I know what it is. I've never tested because I don't care. I have my little things for viruses in my pantry, and if it, I will teach you guys that later. But I've never tested for EBV, and I'm not interested because it's not going to change anything that I do, and I'm doing great. I know how to manage it. I have so many more questions now. Need to go back to book. You're going to be fine. Come to the webinar on Monday. We're going to have a lot more fun. This was just about labs, but there's so much more. Let me see if there's anything else. Make sure you click on that Monday webinar and sign up. We have almost 500 already. I think we may have to increase it to 1,000 because we have a limit on 500. So go and grab the seat. It's free. Thank you, Bobby. Hi, Bobby. Oh my gosh. Okay, you guys, I have to go. It is my pleasure. We're just getting started, and I didn't tell you we're going to do summits next year as well on EBV, so we're just starting. Many blessings to you all. Take care of yourselves. I hope to see you on Monday on the webinar. Bye.